From Fox 5 News, this is Good Day New York.
All right, Botox. It can banish crow's feet and smooth a furrowed brow, but some patients say it's worth its weight in gold because it now can help migraines.
Yep. On Friday, the FDA approved the popular wrinkle erasing injection for the treatment of chronic migraines. Joining us this morning is Dr. Mitchell Chasin, who administers Botox, and patient Laura Daugherty, both to Good Day New York. Nice to see you.
Thank you.
Doctor, the FDA just approved this, but you've been doing it for years.
Right. The Botox is approved for many different uses, including cosmetic purposes, but the FDA recently, after a large study, approved it for the use of treating migraines.
So if you get it for migraines, are you basically getting rid of the wrinkles as well at the same time?
When we treat migraines with Botox, we use a different treatment program. We actually administer 4 to 5 times as much Botox as we would if we were treating some
Oh no, you're going to have people looking paralyzed.
Well, Laura Daugherty, first of all, where do you live?
Bridgewater, New Jersey.
How long have you suffered from bad headaches?
Since I was a teenager, so almost 30 years.
And the Botox has done the trick here?
It's a life changer.
Tell me.
It's terrific. Since Dr. Chasin started doing the Botox treatments, I've gone from 2 to 3 migraines a week to maybe 1 or 2 a month, and they're not nearly as severe as they used to be.
Wow. And how do you look? You look younger to me. I don't know.
I think it looks good. I do. I know Dr. Chasin says it doesn't look as cosmetically elegant as when you do it just for the wrinkles, but I don't see any bad cosmetic result either.
Why? Because it's just it's too much Botox?
There are different locations we need to inject when we're treating a patient with migraines. So we may hit the forehead a little harder than we would do normally. We're also treating the back of the neck, we're treating the scalp area, etc.
And all right, so you put it right in the forehead for you, Linda. All right, a little bit painful, right? Ever so slightly, little pinch.
Pinch.
Not a big deal. Did they know this about Botox when they developed it initially, that it could have this kind of effect?
It wasn't known originally. We noticed it when we were treating patients for cosmetic purposes. They would come back and say, you know what, I look great, I feel great, and you know what, better yet, my migraines are gone.
Huh. Now, how long does it last?
It lasts approximately 3 to 4 months, and with subsequent treatments, it actually can last longer.
That's true.
You would recommend this, Laura?
Highly, absolutely, to anyone who suffers
How
from headaches.
How expensive is this, though?
Well, you know, it varies. Depends on, I guess, the type of headaches and how much you're getting. But about $300 to $400 a treatment.
And shouldn't there, doctor, be a different kind of pricing plan for this because it's not cosmetic? It's for health reasons, and you know, health insurance, those kinds of issues might come to bear here.
With the recent approval, now the insurance companies will likely cover the treatment. For cosmetic purposes, the cost normally $300 to $400. With certain migraine sufferers, that cost may go to $1,500 to $2,500 because the amount of Botox required is much greater.
What are the risks?
Not many. Botox has become so purified today that the risks are really very few. The most common risk someone would see is a drooping of the brow or a drooping of the lid. But with a good treatment plan, those risks can be avoided.
Well, terrific. And you feel great.
I feel great.
1 to 2 migraines a month. What sparks it?
You know, with migraines, it can be a lot of different things. You know, sleeping less or more, too much stress or a little less stress. Any kind of change in your sort of daily routine tends to spark a migraine.
Avoid the set of Good Day New York.
All right, let me ask you, will this treatment help everyone with migraines?
It helps the majority of patients with migraines. We see approximately 80 to 90% improvement in that migraine history. But this is not for every headache sufferer. This is not even for the patient with an average number of migraines. This is used for patients with a chronic history of migraines, that being a patient that gets at least 15 migraines a month. So we're saying 50% of their time is spent in agony.
And it can be agony. I've heard people, they want to literally jump out the window during some of the more intense migraines.
It's hideous. You're in a dark room, you can't have any noise at all, you can do absolutely nothing. It's totally debilitating.
Well, we're really happy that this has helped you. Laura Daugherty, Dr. Mitchell Chasin, thank you so much for being here.
Thank you.
For more information on Botox for migraines, go to myfoxny.com, click on the Good Day tab.
All right, coming